Welcome everyone. So today we will have a really interesting episode, a little bit different than what we usually have. So we will talk about electrodes. So how to choose electrodes for long-term heart rate variability or ECG monitoring. And we have a great guest today. He's been working a long time with electrodes and he knows about everything of them. So, ladies and gentlemen, please welcome Jose Naf. Welcome, Jose.
Hi, Olli. Thank you for having me here.
Yeah, great to have you. So maybe before we go to the topic, maybe you can tell a little bit about your background, your education, and how you ended up working with electrodes.
So my background is from the business side. I study at the University of St. Gallen. And in 2016, I founded my first startup, which was in computer vision, in that area, retail analytics, computer vision. Later, I sold my shares and I went as a founder of Nahtlos with an engineer. And he worked at EMPA. EMPA belongs to the ETH, which is quite famous in Switzerland and in Europe as a technical university. And it's a Swiss laboratory for material research. And they developed their different technologies, and I found that quite cool, of the idea of taking a technology and bringing it to the market. And then we looked at the different innovations they had and decided to bring textile belt to the market. So that's how it started. That was in 2020.
Yeah, sounds interesting. And maybe before we go to electrodes, how do you develop materials? Like, I'm not an expert on it, so what does it entail? Like, you probably test different kind of combination in the lab and you see, and yeah, maybe give us kind of some idea that what
So
happens there. Yeah.
since I'm the business student, I'm not a material expert, but working with materials and finding the right materials has been very challenging. And it's a lot of testing. So materials like which glue do you use, which adhesive for the skin, which conductive material for the electrodes and so on. That has been always a challenge. Nowadays, we use a lot of large language model before we choose the right material by basically getting some ideas, what are the properties of the materials and what are the temperatures and how can we combine them with other materials. So one very concrete topic, we have an electrode for long term, and here there is a puppet, and this puppet has a certain plastic. Before we used another plastic, and then we realized that actually the plastic we use releases water steam. So the puppet has water in it, but when it doesn't hold for 2 years, it would be not as nice for the medical service provider. So, and that is something we figure out with the large language model by asking which properties have which vapor barrier, which plastic has which vapor barrier.
Yeah, very interesting. I have read sometimes the stories of 3M that somebody was developing really good glue and it didn't work at all, and it became the post-it notes, like you screwed up fully and then it became something good. So yeah, I know the story. So if we then go for the electrodes for ECG and HRV measurement, what are the main types that are currently available in the market, and what are the differences between the different types?
So currently there are three main types which are well known. The first one is the wet gel electrode. And wet gel is maybe 60, 70 years old. It was one of the first gel which was developed. For example, there's one very famous one, which is the Ambu. And the wet gel has the property that is very fast, on the one hand, absorbed by the skin. It sometimes even like solves the epidermis, the first skin layer. So the signal quality is better because the impedance is lower. However, it doesn't last that long. So mostly it's maximum 3 days for the very good ones. Normally it's maybe 1 hour or 2 hours, depending on the use case. If it's an ECG in the hospital or is it a Holter ECG. So there are also different wet gels. The other one is the solid gel. Solid gel it's less aggressive to the skin, and then you can stick it away and replace it. But then there are some drawbacks that, for example, when there's a high humidity, it will fill up. It will take the humidity from the air, and then it wouldn't stick that well anymore. Or when the patient is sweating, there's a high chance that the electrodes actually doesn't stick anymore. So, and the impedance is not as good. So the chance of having motion artifacts and others not very good signal increases, obviously, with the solid gel. And then another very well known is everything what is with dry electrodes. Here in that case, it's the textile version. Then you have polymer dry electrodes. And the problem with the dry electrodes is that they have a very high impedance to the skin. So it's very difficult to actually reduce the impedance. In order to reduce the impedance, either you put on gel or you put on water. So that's why when you have a polar belt before running, you put first water on, and then later the signal quality will be good because the body's anyway sweating. But for medical measurement, it's not enough. And there's another point with the dry electrodes, since they don't have adhesive, mostly, they will not stick to the skin. So all the smart textile shirts, they actually failed, or at least I don't know any smart textile which is really taking off or took off, because it will move around the skin, and then every time it will be a motion artifact. And then the last one, it's actually our innovation, which is a mix between dry electrode and wet electrode. But the way we solve it was not with gel, but with a humidification system. So the belt I showed before was originally a dry electrode with a semi-permeable membrane, which creates an artificial sweating. So you would have the right amount of water, and it functions with partial pressure. So when the body is sweating, there is no water steam released through the semi-permeable membrane, and you will have the right conditions for long-term measurements. So these are the four main characters in the electrode.
Sounds interesting. And as now as we talked, I remember that I did my PhD with the dry electrodes. So measuring electromyography from the thigh muscles, quadriceps and hamstrings. And yeah, we did them in the summer. We sprayed with water, but yeah, it was a lot of artifacts, a lot of data analysis trying to clean the data. Yeah. We measured like several days, and yeah, it was not very good. It was a lot of work. So yeah, I have some experience. And so basically there's wet gel electrodes, solid gel electrodes, dry electrodes, and your mix of these. So basically with dry electrodes, would you say that they are not good enough if you need to measure ECG heart rate variability for scientific purposes? The impedance is too high.
It obviously depends. If it's for a runner, then the placement of the electrodes are quite well done with a belt, because it's here right at the heart area. But then if you want to measure 24/7 or maybe for 3 days, then it on the one hand, it becomes a pain, because sometimes the skin starts to stick on the dry electrode. So when you take it away, you will have quite strong, irritations, or even the blood is coming a little bit. And on the other hand, you would need to always humidify it to have good signal quality, because when it dries, the impedance goes up, and then the signal quality is much worse, since the motion artifacts react stronger. And so, I wouldn't recommend them for long-term measurement.
Yeah. And basically, you already said some of the things why they might fail in the longer measurement, for example, the solid gel. But maybe if you tell us, like, why do many of these commonly used electrodes, why do they start failing after a few days of wearing?
So when you look at the wet gel electrodes, for example, the blue sensor, the Ambu one, which is the most famous, that's a very good electrode. It's very good until 3 days, because the gel which is used is quite aggressive. So it dissolves a little bit the skin, the impedance is reduced. But then the drawback, it's not for long term I mean, I'm talking about long-term, 7 days and plus. And that's why they say maximum 72 hours. And after that, you have to exchange it. Most hospitals tell the patients to exchange it every day. And one reason, it's not only the gel, but it's also because it's a wet gel, you have on the side basically like a protection that the gel doesn't go out when the patient is lying or so, that it's not just squeezed out. But then what happens is that this side wall actually cuts into the skin. So this is another factor. It doesn't have to do much with the gel. It's just, but you need it in order to keep the gel inside. So you have different factors why it fails actually for long term. Because after maybe 24 hours, you will start to be itchy. Some people react very strong. We have seen all kind of very ugly pictures or ugly cases where you have blisters and so on. And beside this physical barrier, you would also have the gel, which is very aggressive. Then the solid gel, it's also quite good, especially for the little devices, which has mostly like some patches, because you don't have much cables which are pulling on it. So adhesive is a little bit stronger since there are less cables which are pulling on it. But then at the same time, you wouldn't see, for the classical Holter ECG, you wouldn't see much solid gel electrodes for long term because the stickiness we lose. Therefore, like most people go for the wet gel with a strong adhesive on the side. And then the dry electrodes, as I mentioned, for long term, it's not an option. For short term or for sports, quite good. Yeah. But as you see, it's a it's a big channel, the electrodes.
Yeah. And when you have the solid gel, is it the whole area of the kind of the sticker is the measurement? Yeah. Area.
Yes, it's the whole area of the sticker. But sometimes not the whole area. They don't only stick it with the solid gel, they would also have some additional adhesive on the side.
Yeah.
But then still, when there's for example, when somebody showers too much or sweats too much, it becomes bigger. It sucks the water from the environment. And then the signal quality also will be loosened, or the stickiness. And then once the stickiness is loosened from the skin, you wouldn't have the contact you would need.
Yeah. And how does it affect the weight of the sensor? So if you have a sensor that is kind of pulling a little bit, it's bending it, and then the electrode moves. And in the AMBU, for example, you have it decentral, so it's not central.
Yes.
But it doesn't pull the electrode.
Very good point.
How is the difference between the wet and solid gel electrodes in this sense? How does the cable, the weight of the device affect? And should you also attach the device to the skin separately and then the electrode? So what would be your recommendation?
Yes, that's a very good point. So who was the first one who had an offset sensor? And the offset snap button, not sensor, sorry, but which leads to have a more flexibility for the cables. And that was a very, very smart invention because it brings a lot of release for the core of the electrodes. And you do have the problem that the sensor can affect the signal quality. And for example, the sensor you showed, it's quite lightweight, which looks quite good during the day. But what could happen is during the night when somebody sleeps on the belly, that then it kind of like pull the sensor away. So even it's lightweight, sometimes when the sensor sticks too much out, it can also affect then the signal quality at night. And so as you see, like not only the electrodes shape or this gel shape is a topic, but then the additional elements, like you mentioned, the offset snap button, or even what kind of snap buttons. It's like some, for example, Bitium has, for the Bitium patches, they use a USB as a snap button or like as a connector. And but in the classic Holter, you have the normal snap buttons. And so you notice they're also quite different.
And what do you think is the best connector?